For the patient's current symptoms, the patient is not experiencing headache, numbness, tingling, seizure activities, dizziness, lightheadedness, problem with balance nor coordination, decrease in ability to taste and smell, ringing in the ear, difficulty in vision or seeing, difficulty in understanding and comprehending, difficulty of swallowing, loss of bowel sound, bowel control or bladder control, that's what I meant, loss of memory, and tremors. Initial interview with the patient. The patient has no history of meningitis, encephalitis, and injury to the spinal cord. There is no history of stroke. As well, for the family history and data collection, the patient has no history of high blood pressure in the family. There's no stroke in the family. There's no history of Alzheimer's. There's no history of epilepsy, brain cancer, and Huntington chorea. So for the lifestyle and health practices, as a description, the patient is not taking any prescription or non-prescription medications. He is not inclined or engaging in taking of marijuana, opioids, cocaine, tranquilizers, barbiturates, or he does not use recreational drugs. The patient is a non-smoker, non-alcoholic drinker. The health practices in riding vehicles, he uses a seat belt whenever he rides a vehicle. Also, he wears a helmet when hitching a ride in a motorcycle. So, 24-hour activity of my patient, he is a medical doctor in practice. Therefore, he goes on duty for 24 hours, having runs with the patients and taking care of the patients as well. So, for the health practices continued, the patient claims that he has no exposure to insecticides, pollutants, or other chemicals. So, there is no recorded lifting of heavy objects as claimed by the patient. There is no repetitive motion of the patient that he observes. According to the patient, the individual activity of daily living is performed normally, so there is no interruption. He's able to do bathing, dining, grooming, and transferring without any assist or help. So there are no neurologic changes as described by the patients. The patient is under stress but does not report any association with any neurological problems. There is no changes according to the patient in level of consciousness, of mindfulness, and orientation. So, I'm done already with presenting my subjective data that I had done in the pre-assessment. I'll be transferring to the other room to do the assessment for the objective data for neurological assessment. Good day, class. Now we're going to proceed to our gathering of our objective data. So, as what we would do, we would be preparing the environment and explain the procedure to the patient. And later, we'll be gathering the equipments to be used. So, we have here the examination gloves, the cotton tip applicators, a newsprint for the patient to read, an ophthalmoscope, a paper clip, a pen light, a Snellen's chart. We have it here. We have the sterile cotton balls, some substance to smell. So we have here our scents, and some flavors to taste. We have the salt, the sugar, and also some lemon zest. Our tongue blade, our tuning fork, our tape measure, some objects to feel, which is our paper clip and keys. Our test tube with either hot or cold, or warm or cold water, and our last but not the least, our reflex hammer. Okay, so we would be explaining the procedure to the patient. So I'll be doing it all now. So for example, I've set the environment. Sir, is the room comfortable? Is it not that cold? Okay. So I'm Val, by the way, your nurse today. So we're going to do our neurological assessment. I'll be assessing the functions, the brain functions, and your other parts of the system. It would be helpful for your assessment and records for the chart. Is that okay, sir? Okay, so I've got the consent of the patient. Sir, I assure you that your privacy, security, and safety is our primary concern as we are going to do our health assessment for today. Okay, sir? So, I'll be proceeding to our test. Okay, so first I'm going to check for the level of consciousness. Sir, so I see the patient is awake. Sir, do you know What's your name?
I am Mark Lumalang.
Okay. So, sir, do you know what date it is today?
Yes, sir. It's April 11, 2021.
Okay. Do you know what time of the day it is?
It's around 8:45.
Okay. 8:45. What, sir? Morning?
Evening.
Okay. It's evening. Okay. So, as of now, before the client came in, I would, per observation, the client is on a gown as he had changed earlier. But before that, he is dressed appropriately. He has good grooming and hygiene. And, sir, could you lower your mask for the meantime? Okay, so the patient is possibly smiling and he has facial expressions. Okay, sir, kindly state the president of, do you know who is the president of the Philippines right now?
Rodrigo Duterte.
Okay, so do you know your birthday?
Yes, sir.
When is your birthday?
June 11, 1991.
Okay, so and now, sir, I'll be going to check for your posture and gait. Could you mind standing up? Hands on your side. Okay. Okay, sir. Try to move, sir. Try to walk around, sir, the room. Okay. Okay, sir. Thank you very much. You may now take your seat. Okay, so upon assessment, the moods, the feelings, and expressions is appropriate to the patient. The posture and gait is upright, standing straight and able to maintain the balance. And we'll be going to the next assessment, or the next part of the assessment is it's the cranial nerves. Okay, so first of all, I'll be testing the cranial nerve number 1, or the olfactory nerve. So what I'm going to do, this is involving the nostrils. So, sir, I'm just going to let you close your eyes and remove your mask, sir, for the meantime. Try to occlude one nose. And then try to determine what scent that I would be letting you smell, okay? So what scent? Did you smell that?
Banana.
Very good. The other nose, could you cover it? Okay. Did you smell it?
Buko pandan.
Okay, very good. So, the patient's cranial nerve number 1, or the olfactory, is intact because the patient is able to determine the sense that I have given him. So now I'm going to assess, sir, your cranial nerve number 2. So it would be involving our Snellen chart. So we have our Snellen chart right there, sir. Could you see it? Okay, so my Snellen chart is at least 20 feet from here. Could you read me the line on number 5?
PECFD.
Okay, very good. Could you read the line lower than it? Line number 6?
EDFCJP.
Okay, thank you very much, sir. So this one was done during your eye assessment, but for this test, you could ask the patient to assess the chart for each vision. So ideally, I would be asking you, sir, now, you've read it favorably with your both eyes open. I would ask you, sir, to cover one of your eyes. Okay, sir, kindly read the line on number 6 again.
EDFCJP.
Okay, the other side, sir, cover it. Please read line number 7.
FELCFED.
Okay, so very good. So my client's vision is 20/20 because he's able to read within those lines in the Snellen chart. So, sir, I have your newspaper. I'll be assessing your fine print or near vision test. Kindly read these 3 lines. Okay.
Filipinos battling the coronavirus infection You'll be getting additional health support from the government.
Okay, so thank you very much. So, upon assessment of the near vision test by reading the newspaper, I would say that the patient has no problem with reading the newsprint or fine print. Okay, now I'm going to, with my ophthalmoscope, I'll be, okay, so it's on. Okay, so you see the light. With my ophthalmoscope, sir, I'll be just checking your eyes. Okay, kindly look straight or far. I'll just be checking it. Okay. Okay, sir. I'll just be doing the other eye. Okay, sir. Thank you very much. Let me just turn on the lights again. Okay, so upon checking for the eyes with the ophthalmoscope, the red eye is visible. Also, there is noted vascularities on the eye. There is no deviation in the shape of the eye. The eye is not swollen, or there is no noted active bleeding on the eyes. Therefore, having a good eye structure for the patient. Okay, so after doing our cranial nerve number 2, we'd be going to our cranial nerve number 3, number 4, and number 6, which is the oculomotor, trochlear, and abducens. So what would we first of all, sir, I'm going to inspect the margins of your eyelid. So kindly look straight, sir. And I'm just going to inspect. Okay, thank you very much. Next, sir, I'll be asking you, sir, to cover your eyes with one of your hand. Cover and then release. Okay, the other eye, cover it with your one hand. Okay, and then release. Okay, so next one, I would be using my pen light, sir, to check for your pupillar reaction. But first, let me dim the lights here. Just use this one. Okay. So, sir, look straight. I'll be checking for your pupillary reflex. Okay, look straight. Okay. Thank you very much. And next, sir, I would be checking for your accommodation, sir. So kindly look at this pen. I have this pen, the side of the pen. Kindly look at it without moving your neck or eye. Kindly follow it. Okay, sir. Next, I would be checking for the muscle control of your eyes. Please look at the pen without moving your neck. Okay. Okay. Okay, thank you very much. So, upon assessment of your cranial nerve number 3, number 4, and number 6, there is the margins of the eyelids are equal in shape and size. It's symmetrical. There are no signs of swelling, redness, or bleeding within those margins. The extraocular movement or nystagmus is not present upon checking the 6 cardinal fields and opening and closing cover test of the eyes. Pupillary response to light is the pupils of the eyes, constricts to 3.5 from 5 upon light accommodation on both eyes, and the eyes crosses when the focusing of an object is found or is elicited to the patient. So I could say that the eyes are pupils equally react to light and accommodation. Okay, So we would be next assessing for the cranial nerve number 5, which is the trigeminal nerve. So sir, what I need you to do, please remove your mask for the meantime. Okay sir, try to make a try to bite. Okay, so let me assess your temporal and masseter area. Okay, so sir, I'll just be assessing also your TMJ. So you try opening and closing your mouth, then making a bite. Okay, there you go. Thank you very much, sir. Next, sir, I would be doing sensation test on your face. Okay, sir. So I'll be using this paper clip, and I'll let you close your eyes and tell me if ever you're feeling a sharp part or a dull part of the paper clip. Is it okay? So class, I'll just focus it here. This is the sharp part of your paper clip, and this is the dull part of your paper clip. Just be careful not to poke the eyes of your patient when doing this test, okay? Sir, I'll just be poking your face, okay, sir? Did you feel that, sir?
Yes.
Was it the sharp or dull?
Done.
Dull? Okay. So, wait. Okay. Okay, again sir, I'll try. Sharp or dull?
Done.
Okay. This one?
Done.
This one?
One more. Sharp.
Okay. This one?
Sharp.
This one?
One more sharp. Sharp.
Okay. This one?
Sharp.
So sir, next I'll be testing for your corneal reflex. This is a little bit uncomfortable, but before that, I'll just do my hand hygiene. Okay, so class, now for testing your corneal reflex with a wisp or sterile cotton balls. Okay, you have to make a little bit of edge for your cotton balls, and you're going to poke or flick the sides of the cornea of your patient. So what you're going to instruct is tell the patient to look away. So for example, you'll be poking this one. Tell your patient to look at that side. Okay, sir? Okay, very good. Sir, to this side. Look to the other side, sir. Just be testing for cranial reflex. Thank you very much. Okay, so upon assessment of the cranial nerve number 5 or the trigeminal nerve, the client is able to clench his teeth while palpating the temporal and masseter muscles. There are no signs of redness. There's no pain or crepitus noted. Upon touching the client's forehead with the paper clip, the client is able to identify the dull and sharp parts of the paper clip, and since therefore there is no alteration in the perception of the client for the sensation. And then for the corneal reflex, the client blinks when the cotton is flicked or wisped upon his corneal area. Okay, and then usually the eyes react accordingly. It blinks and it closes as against that foreign object. Okay, so next assessment we're going to do is the cranial nerve number 7, which is the facial. So basically, class, you're just going to give instructions to the patient. So this is how we would do it. Sir, kindly remove your mask again, sir. Sorry for the discomfort. Okay, sir, kindly give me your widest smile. Okay, kindly frown. Okay, sir, wrinkle your forehead. Try wrinkling your forehead. Very good. Please show your teeth. Okay, pop your cheeks. Okay, thank you very much. Do a pursed lip like blowing. Okay. And next, try raising your eyebrows. Okay. Please close your eyes open. Now, sir, I'm going to add resistance before you close your eyes. Okay, sir. Open your eyes first. Try closing your eyes. Okay, very good. Open your eyes again, sir. I'll just be doing it in the lower part. Try closing your eyes. Okay. So, as a part of the facial cranial nerve or the cranial nerve number 7, we're going to do a taste test. So, how would we do this? Ideally, I lost my spoons, but prepare 3 spoons with your flavors. So, make sure that your flavors are tolerable for the patient. So, I have here salt, iodized salt. I have here lemon or calamansi, and I have here sugar. Ideally, you don't tell the patient of what flavors that you have kasi the patient might guess and the guesses might be accurate. So, for demonstration purposes, I'll just be telling the salt. So, let's go on with the assessment. Sir, this is the instruction. I'll be letting you taste some flavors that are tolerable. Kindly tell me what flavor do you identify in your mouth. But this test would be done with your eyes closed. Is it okay? Okay. Close your eyes, sir. Okay, for the first one. Okay. Sir, please taste. Okay. Please extend your tongue. I'll just be putting this in your tongue. Okay. Kindly test. What flavor do you test or taste?
Sugar.
Okay, very good. The next flavor would be okay, what do you taste?
Lemon.
Okay. What flavor is it?
Calamansi.
Okay, very good. And last but not the least, let me change my last but not the least, let me just change my padded tongue blade or my spoon for the last ingredient. Okay. Okay, sir. Kindly try to tasting it with your tongue.
Salt.
Okay, so it's salty. Okay, sir, you can now open your eyes. So, for the cranial nerve number 7, the facial, for the motor test functions, the patient is able to express or move muscles in his face by smiling, showing the teeth, popping his cheeks, doing a pursed lip, raising his eyebrows, or closing and opening his eyes with or without resistance. For the taste test, the patient is able to identify the 3 flavors, which is the sugar, the lemon, and the salt in order. Okay, so we're going to assess the next cranial nerve, which is our acoustic or vestibulocochlear cranial nerve by assessing or doing our Weber's test. So remember your Weber's test and the RINNE test. Sir, I'll be checking for your capability of ears on hearing sound via vibrations. Okay, sir. For the first test, I'll be performing the Weber's test. What I'm going to do is I'm going to place this activated tuning fork in the top of your head and tell me if you would be hearing the sounds of or on both ears, single ear, or no sounds at all. Is that okay? Okay. So can you hear it on both? Can you hear it?
Both ears.
Both ears? Okay, sir. For the next test, I'll be doing the RINNE test. Just tell me if you could not hear the sound. I'll be placing it here in the back of your head, back of your ear, near the bone here. And then later on, when the sound from the conduction or vibration here diminishes or fades, kindly tell me. And then I'll be putting it in front of your ear or near your ear. And also likewise, if you don't hear the sound, just tell me. Is it okay? I'm sorry. Okay, so no more. I'll just be doing it in the other ear, okay? So upon checking of both the Weber's test and the RINNE's test, we could say that the cranial nerve number 8, or the acoustic or vestibulocochlear cranial nerve, is intact because there is no what they call this, hearing loss by a vibration by doing the Weber's test, and it's both heard on both ears. And for the RINNE's test, the patient is able to hear the vibration here on the back of the ear and in the in front of the ear. That is the air conduction time, or having your tuning fork in front of the ear, is greater than having it on the bone in the back of your ear. So air conduction greater than bone conduction. So therefore, we could say that our cranial number 8 is intact. Okay, so I would be assessing, sir, your cranial nerve number 9, which is the glossopharyngeal, and also your cranial nerve number 10, which is the vagus. So, sir, what I'm going to do is I'm going to insert tongue depressor, and you just follow what I say, okay? Sir? Okay, sir, kindly remove your mask. At this point, since I know my patient and he's my brother, you could wear your gloves here at this point, okay? You could also have your pen light so that you could assess them out as well while doing your assessment. Sir, please say a big ah. Okay, I'll try to depress your tongue. Okay, I'll be doing a little bit of maneuver. It might be uncomfortable just to test your gag. Okay. Sorry for that. So you see that it's very uncomfortable with the patient upon doing the gag reflex. So therefore, again, sir, now, sir, I want you to try to swallow. Okay. So by doing or assessing the glossopharyngeal, by doing the tongue depression, eliciting the gag reflex, and trying the patient to swallow, I could therefore say that the cranial nerve is intact because the gag reflex is activated when there is stimulus. At the same time, the patient is able to swallow without any difficulty. Where is there difficulty when swallowing? Pain. Okay, so there's no difficulty in swallowing or pain during trying to swallow. Okay? Sorry for that, sir. It's really uncomfortable. So while assessing the patients there, just try not to overstimulate the gag reflex, because especially if your patient has already just eaten his or her food, the patient might vomit. So be careful while doing this activity. Okay, so sir, next we're going to test your cranial nerve number 11, which is your spinal accessory muscles. So what please, I'll stand behind you, sir. A little bit forward. Okay, sir. Now, I want you to try to shrug your shoulders, raise your shoulders. Okay. Again. Okay. Now, I'm going to test the movement of your head. So like what we done with musculoskeletal, this is movement or range of motion against resistance. Okay, sir, try moving your head left. Okay. Next, try moving your head right. Okay, thank you. So for testing, upon basic testing of the spinal accessory muscle, the patient is able to shrug the shoulders with resistance, and the patient is also able to turn his head with resistance. Therefore, meaning the cranial nerve number 11 is intact. So for the cranial nerve number 12, which is our last cranial nerve, again, sir, I'll try to remove your mask. Okay. This one is more of your tongue movement, sir, okay? Try opening your mouth, protrude your tongue, or move it to the right, move it to the left, up, down. Okay, thank you very much. I've already done the resistance against tongue depression earlier when I checked for the vagal or the throat. So I could say that hypoglossal or our cranial nerve number 12 is intact because the patient is able to move the tongue with upward, downward, sideward movement, and the patient is able to lift the tongue depressor as earlier as I did upon checking. Okay, so we're done with the cranial nerves. We're going to the next assessment, which is the motor and cerebral system assessment. Okay, so this part will be assessing gait and balance as what I have done earlier in the part of the checklist. I already checked for the gait of the patient. He's able to bear weight. There are no involuntary movement by standing straight. He is walking normally as what we've done with musculoskeletal. He is able to swing his arms with normal cadence, and there is no jerking movement while walking. So sir, now I would ask you again, sir, to stand up. This one is a special kind of walk. I'd be asking you to perform the Romberg's test, sir. So this test, you would be walking with your foot, your toes would be touching your heel, and then try doing it in a straight manner, sir. Okay? So please try it. Kindly remove your slipper, sir. Okay? So please walk. There you go. If your patient is an elderly, try to be with him or her. So try going back, sir. Doing the same. Okay, sir, what I want you to do is put your one foot up and try to jump and land. Okay? Okay. Then down. The other foot. Okay. And okay, then down. Thank you very much. So, done with our muscle gait and balance. So the patient is able to maintain steady gait even if the patient is hopping on one foot. He lands with a little bit of off balance but able to regain balance as well. What I want you to do, sir, is hold your arms out, okay? And then try lowering again your mask, sir, or remove it first. Now this involves your touching of the nose, okay? So what you're going to do is hands to nose, okay? Okay, do it faster, sir. Okay, thank you, sir. Now, sir, you've done already it. You've already done it with your eyes open. Try closing your eyes and doing it. First, slow. Okay, then faster. And faster again. Okay, thank you very much. So, for the coordination, the patient is able to touch his nose with a fluid and smooth movement with his eyes open and closed. Okay, so the next one, I would like you to do like this, sir. Your thumb would be touching all of your fingers, so like this. Okay, sir, please do that. Okay, and then just one, sir. One finger per touch of the thumb. Then back. Okay. Try doing it a little bit faster. Okay. Thank you, sir. So, next one would be place your hands on your legs and then try flipping it. Flip up, down, then faster. Okay. Thank you very much, sir. So, the last part, I would be asking the patient to lie down, which is the heel to shin. So, what I want you to do is slide your heels towards your shin, up, and then down. Okay, and for the other leg, try doing so. Okay. Okay, thank you very much. Sige, sir. Just relax there first, but don't fall asleep. Okay, so for this motor assessment, I could say that the patient is able to stand straight, as I said earlier. The Romberg's test, the patient is able to perform it with the heel to toe movement without any difficulty and is able to do it in a straight line and pattern. So now we're going to assess the light touch and pain and temperature. So okay, what I have here, I'd be needing again my paper clip with a sharp edge, and I have here two vials. This one is my warm and this one is my cold. Okay, so sir, I'm just and you're going also to use your cotton. So for equipments, your sharp, which is your paper clip, your dull or the soft would or light would be your cotton, your warm and your cold test tube or container. Okay, sir. For the first test, I would ask you, sir, to close your eyes. This would be testing for the light touch. Tell me, sir, what part of the body does the cotton damp you on, okay? So,
Left arm.
okay,
Right foot. Left foot. Right arm. Left arm. Left arm.
okay, so very good. Now, sir, the same again. Please tell me the location, or if you want, you could point it where.
Left. Right. Left. Right arm.
Right?
Right leg. Left leg. Left arm. Right arm.
Okay, so very good. The next one, I would like you to identify the object that I would be the temperature on where.
Left arm cold. Right leg warm. Right arm cold. Left leg warm.
Okay. So upon assessment of for the light, touch, pain, and temperature, the patient is able. Thank you, sir. You can now open your eyes. The patient is able to identify areas in which light, touch is elicited, pain sensations with the use of the paper clip, and the temperature test with the warm and cold items that I have. Okay, with his eyes closed. Okay, so the next test would be the vibratory test or sensation. So what I'm going to do, sir, is I would be striking the Neuro hammer and tell me with your eyes closed where the Neuro hammer is placed or located. Okay?
Left shoulder. Right hand. Left leg.
The patient is able to identify vibration on selected areas of the body. I would be assessing for tactile discrimination or fine touch. Okay, sir. I would like you to close your eyes. I'll be placing objects in your hand and try to identify it. Is it okay? So open your hand, sir. Okay. So please close your hand. Try to identify the item.
Keys.
Okay, very good. This one, on your right hand, please identify.
Paper clip.
Okay. I'll be putting two objects on both of your hand. Please identify both.
Coin on the right and keys on the left.
Okay, very good. So now, sir, I'm just going to use this blunt object to write objects on your hand. Try to identify it. Okay.
Number 8.
Okay. Here on the other hand.
5.
Okay, very good. Now, sir, I'm going to do the two-arm or the two-point discrimination. Please tell me where I would be pointing or touching. Okay?
Both arms. Both legs. Both shoulder.
Okay.
Both face. Both hands.
So, upon assessment of the tactile discrimination for the stereognosis test, the patient is able to identify familiar objects like the coin, the paper clip, and the keys. For the patient is able to identify points, which is touch for the single and the 2-point discrimination. Also, the patient is able to, upon testing for the graphesthesia test, the patient is able to identify what number or letter that is written in his palm or hand. Okay, so therefore, the patient spine touch is working properly. Okay, so now, sir, I'll be doing your reflexes. So I'd be doing I'll be testing your biceps, I'd be testing your wrist, and I'll be testing your triceps as well with the neuro hammer. Okay? Okay, sir. So make sure that when the patient reacts, you're not in the hitting position. Okay? Okay. So I'll be testing, sir, here. Okay. Now on your wrist. Okay. The other side. Sorry. Okay. For wrist. Okay. So upon assessment for the bicep, the brachioradialis, and the triceps, the reflexes are intact and able to react when the joint or the tendon or elbow is the reflex or the tendon is hit by our neurological hammer. Okay. Okay, sir. I will be testing for your reflex here. Okay. So it's ticklish and it reacts for the other foot. Okay, so both of the plantar reflexes are working. Now, I will be testing your abdominal reflex. Okay, sir? Okay, so the abdominal muscles move upon eliciting strokes on both of the umbilical area. And for male patients, you may also do the cremasteric reflex for male. But since this one is not that part of what they call this, the intensive or the specific assessment, we would be skipping this one in the return demonstration. Okay. Now we're going to assess for meningeal irritation or inflammation if ever you're suspecting for meningitis or meningeal irritation. So, first of all, make sure that the most important thing here is make sure that your patient has no cervical injury or vertebral injury. So meaning no neck injury or spinal cord injury. So while the patient is lying supine down, so for example, the patient is a suspect for a meningitis, we would be testing for the Brudinsky test. This is doing by flexing the neck. So I'm going to watch the hip for any reaction or maneuver. So positive Brudinsky's test, when you flex the head, the hips would go up. Okay, so sir, I'll just be laying you flat. And thank you, sir. I'll just be observing you as well. Okay, so for patients, try. Okay, so is there any pain or stiffness in the back of the neck? Okay, so the patient is negative for Brudinsky sign. Okay, so that's a mouthful of a tongue twister. So upon flexing the neck, there is no movement of the hip and there is no rigidity on the neck area. Next one, we would be testing. Now we're going to assess for the Kernig sign. This is we're going to flex the knee of the patient one leg at a time. And then we would be flexing it towards the hips and then extending it. What we're going to elicit here, or what we're going to observe here, is that the client would not be feeling any pain for the test to be negative. So let's do the Kernigs. And while doing this one, watch for the hips. Okay, sir, I'm just going to flex your legs. Okay. Is there any pain? Okay. I'll be doing it also in the other foot. Going to flex your knees. Net straight. Any pain? Doing the Kernig sign. There is negative pain during the flexion of the legs. Okay, so meaning there is no inflammation of the meninges and there is no hip movement as well. And that summarizes our assessment for our nervous system. So once we're done, don't forget to do hand hygiene as well, formulate our nursing diagnosis, try to formulate and collaborate with other healthcare practitioners to resolve the problems if there are any, and make necessary referrals. And last but not the least, try to document all your significant or pertinent findings. So I hope you learned something today. From my patient and me, we wish you and we hope you a great day ahead. Okay, so bye-bye.